Hi, thank you for coming to meet with me today to talk about restructuring of the cardiac stress lab. My name is Kimberly Gervais. I'm the non-invasive cardiology manager here at Brandon Regional Hospital. And I want to share with you some of the insights that we have seen over the past couple of months with the cardiac stress lab and how we can improve our workflow and hopefully the satisfaction of our patients and our physicians and our employees. So let me start my presentation here for you. Give me just 1 second to share this. And again, this presentation is regarding restructuring of our cardiac stress lab. And lately, our hospital's been reevaluating some of our processes and procedures, mainly because of the Affordable Care Act has put on some strict regulations onto the hospitals, and we're needing to refocus some of our energies to other areas to make sure that we're meeting their guidelines. Our observation patients, they are required to, from the point that they are admitted into observation status, to be discharged within 24 hours in order for our hospital to receive reimbursement. This is a very short amount of time to get a lot of testing done and results in a patient discharge safely and effectively. We have a lot of increased patient volume, and this has actually led to some staffing shortages throughout the hospital. I know the hospital has added some nurses throughout some of the nursing floor departments, but the ancillary departments have not received those increases yet. So our patient volume is up over 10% prior year. And just within about the past 3 years, we have about 5 new practicing cardiologists. Some of them are independent practitioners, which pose a little extra challenges for us in the cardiac stress lab to schedule their tests because they need to get to their patients in their clinics, and they don't have partners that can come in and relieve them from any of their duties. So that just posed some challenges. So we also, we don't have enough staff to cover the increased volume. We have 3 positions in the cardiac stress lab. We have 2 full-time registered nurses and 1 full-time EKG tech. And we are going to go over these positions, mainly the EKG tech position, and how we can refocus that into making it more beneficial for the department. So our recommendations for the restructure of the lab, we would like to eliminate the full-time EKG tech position. This position has been there for 25 years, and it has not grown with the hospital. It, it's just the skills are very basic. Our current EKG tech, actually, she's not current any longer. She just retired after 20 years in this position. So it's allowing us the opportunity to restructure it and to add additional skills and make it work better into the demands of the hospital. We want to create the full-time cardiac tech position. This position will offer some better support, and we would like to update the hours of operation for when the lab opens. Some of these new cardiologists would like to come in at 7 a.m. to get their testing done so they can be in their offices by 8. So we would like to be able to do that and accommodate that for them. And then we would like to in order to make the cardiac tech position possible, we need the nurses or the certified nursing assistants to perform just the stat EKGs on the floors, not the routine EKGs, but just the stats. So we have a quick comparison. The EKG tech will only they only perform EKGs, and they don't have any certifications. They do some administrative duties, and their pay is minimal. It's almost just above minimum wage. For the cardiac tech position, they bring us multiple skills with EKGs, stress halters, multiple certifications. They can be the super user for our Muse, which is our electronic medical records for our EKG system, and they'll really be utilizing their 8-hour shift. They do get paid a little bit more, but the skill set is worth the pay variance. The EKG tech, they only perform an average of 8 EKGs daily, and it only takes about 10 minutes to perform this test, so the full-time FTE is not really being utilized the way we would like it to be. Most of our EKGs are done in the emergency room, so with only the 8 EKGs and 3 hours of administrative work, they're really only utilizing 4 to 5 hours of an 8-hour shift with productive time. They cannot offer any assistance to our stress lab. The cardiac techs, they can perform all the tests. They can do the stress testing, EKGs, Holters, which right now the nurses are having to download, and it can take hours to download a Holter. I mean, they can be the super user. For our new system, an advocate for the physicians, they can monitor the heart rhythms, therefore they can do the stress testing. They're certified cardiographic technicians and basic life support. They can also get their ACLS. Median hourly rate comparison, we did that just a little bit ago. Again, the difference in pay would actually, over a year's time annually, would save the hospital actually about $20,000, because currently we have the stress tech on staff almost on a daily basis, and it would eliminate that position. Not eliminate the position, but actually having schedule that person every day. They would probably just be scheduled on the weekends rather than through the week. Benefits here, we're going to improve the stress lab workflow. We're going to reduce the work on the RNs. They're probably going to have assistants every day. We've done a 3-week trial already on this position since Matt retired, just to see if the workflow would work, if it would be too much work. Excuse me, for this position. It's actually already increased productivity, and the lab is positive again. Excuse me, my throat's getting dry. And it will certainly be full productive 8-hour use for this position. Part of the 3-week trial analysis, the productive hours, you can see they were negative, they're now positive. Our units of service have gone up. Less man hours being used. The challenges are just enforcing the new policy for the STAT EKGs, which if the nurses are truly caring for their patients properly, they will want to know the status of the patient who had that declining condition and perform the EKG on their own. And just for human resources to be able to compensate fair hourly rates for this new position. So the results of this restructure is really a reduce in the observation status patients. We'll hope we can get them out of the hospital sooner. Accommodate our physician schedules, therefore increasing physician satisfaction. Reduce the workload on the stress lab, and hopefully improve employee satisfaction scores, because they did decline this past year. And hopefully we can offer them some more support. We have our references, and I did interview some of the stress staff. So let me come back to you guys and wrap up. There you are. Well, I want to thank you for joining me. If you have any questions, you can call me at extension 6031, and we can discuss these changes. And as of right now, we will continue with our clinical trial and continue with positive productivity, and hopefully soon we'll be able to change the hours of operation for our lab to help accommodate the cardiologist. Thank you for your time.